In this presentation, we will discuss steps to solving a medical coding exam case study. But first, I want to introduce you to the team. First up, Mr. Sandeep. Mr. Sandeep coming to you live from Abu Dhabi. He is an AMCI co-lead instructor. Next up, Miss Eva coming to you live from the state of Florida. She is also a co-lead instructor and the intern coordinator. And finally, myself, Mrs. J. I'm the curriculum director at AMCI. Now, let's meet the AMCI interns. We have Miss Anubama, followed by Miss Carla, Miss Courtney, Miss Dolly, Miss Vivian, and Miss Melissa. Goals of the presentation. We will extract the correct codes from medicine documentation. Now let's talk about how to solve a multiple choice case study scenario the AMCI way for the board exam. This is how we do it. We teach you to highlight your key terms, and this key on the right tells you the colors that you should use and for what. A yellow highlighter should be used for diagnoses, all diagnoses, signs, and symptoms. The green will be for procedures. So if you have a green highlighter, the green will be used to highlight only procedures. And pink, these are inclusive or bundled items. All right? Once you've done your highlighting, you're going to have to document your inventory. That's your procedures, diagnoses, and select a primary code. Which diagnosis is primary, which procedure is primary. Then you're going to review all pertinent guidelines. And finally, the code that best matches your inventory list is often the correct code, or a code that is pertinent to a guideline. That will be your best code. All right. So here are some do nots. When you're highlighting, you can kind of get discombobulated. So we've compiled some things that you don't even have to highlight. Number one, don't highlight things observed by the physician because you cannot code for them. Number two, don't highlight closures. If a provider or surgeon is closing up a surgical site, there's no need to highlight it. However, if it involves a skin procedure or skin defect closure, you may definitely have to code that. So if it's closing a surgical site other than skin defects or wounds or lesions, you do not code it or highlight it. Also, you don't highlight bleed control, hemostasis, because that's pretty customary and it's bundled into the procedure code. You don't highlight drains, irrigation of the surgical site. Nope. And you don't highlight installation and removal of clamps and trocars because these are used to open up or maintain the surgical or operative site so the physician can view what they're doing, particularly if it's an open procedure. Also, you don't highlight dressings. And finally, you do not highlight surgical risks. Now that we've gotten that out of the way, I think you're ready to get started, and I'm going to hand it over to Mr. Sandeep. All right, Mr. Sandeep, take it away.
Let's move on to the final chapter of part 3. One more is there, ENM is there. But for today's class, that will be medicine section. And let me invite Miss Courtney for the first scenario. Miss Courtney, are you ready for this?
Yes. All right,
Take it.
coders. What are the CPT and ICD-10 CM codes reported? A96567, L57.0, B96573, L57.0, C67221, L57.0, or D96574, L57.0. Pre-procedure diagnosis, extensive keratosis lesions of left anterior neck. Post-procedure diagnosis, keratosis lesions left anterior neck. Procedure, blue light photodynamic therapy with topical skin sensitizing agent. Patient here for photodynamic therapy. Verbal instruction of procedure given to patient with patient verbalizing understanding. Patient position self in supine position on exam table. Safety goggles applied to eyes, noting patent seal and full coverage of ocular orbital areas. Application of topical Levulan Kerastick applied to left anterior neck keratosis lesions. Blue light lamp adjusted to reflect on left anterior neck. Phototherapy duration, 15 minutes. Post-procedure skin was slightly reddened, no swelling noted. Post-procedure instructions were discussed with patient. Patient to return to office in 8 weeks for assessment and possible repeat treatment. Procedure performed by the physician. All right, coders, your time starts now.
And that's 2.5 minutes, coders. I thought this one would be a little bit tricky scenario, but you all have unanimously said not today, Mr. Sandeep. This trick is not going to work on us. So thank you, Miss Courtney, for reading that scenario for us. And let's do it, coders. The post-operative diagnosis is one which we take. That would be keratosis lesion, left anterior neck. The procedure performed is a blue light photo dynamic therapy with a topical skin sensitizing agent. Patient was placed in a supine position. Safety goggles was applied to the eyes, and application of a Levulan Kerastic was done, which is medicine. A blue light lamp was adjusted to reflect to the anterior neck. The phototherapy duration was around 15 minutes. And the correct answer, and there is one more thing which we have to highlight over here. The procedure was performed by the physician. That is a key thing in our scenario, and the correct answer would be Option B. Okay. And let's have the procedure inventory: blue light photodynamic, diagnosis inventory, keratosis lesion, left anterior neck. And this is what photodynamic therapy is all about, where a single combination of a light, where a combination of a light, sensitizing drug, and bright light will be used. Doctor actually puts these creams that contains light sensitizing chemicals on the skin, that is used to treat various alignments. It can be used to treat something like keratosis lesion, as in our scenario. It can be also used to treat something like cancers and all. So what doctor do is that he will apply this particular medicine over the skin, and then uses a photodynamic therapy, light therapy, which will activate this medication, and that will help us to treat the skin conditions. Okay, and these are the code options which we are having. Let's have a look into option C 67221, which is coding for destruction of lesion of choroid, photodynamic therapy. Now this is particularly on for the destruction of localized lesion which is present on the choroid, which is on in the eye. So we are not coding for eye here. Option C is wrong one. Let's look into the option D 96574. That is coding for debridement of pre-malignant hyperkeratic lesion, followed by photodynamic therapy. So anywhere in our scenario, doctor didn't mention that a debridement of a pre-malignant lesion was performed. He straight away went, applied the the medication, and then followed by he performed a photodynamic therapy. So that's why option D is also incorrect. And option A is coding for photodynamic therapy, external application of light to destroy the pre-malignant lesion of the skin and adjacent mucosa with application and illumination or activation of photosensitive drugs per day. You know what, coders? I would have a look into this answer as well. But this one is wrong, because in the parenthesis it states like news 9 6567 for reporting photodynamic therapy when physician or other qualified healthcare professional is not directly involved in delivery of the photodynamic therapy service. And over here, it has been mentioned that the procedure was performed by the physician. That's why I said in the beginning, this is going to be an important section. So the correct answer would be 96573, which will be photodynamic therapy by external application of light to destroy the pre-malignant lesion of the skin and adjacent mucosa with application of illumination or activation of photosensitizing drug provided by a physician or other qualified healthcare professional per day. So hope that one was clear, coders. How do you feel about that scenario? Good. Okay, let's move on to the final scenario for the day. And who other than Miss Eva is a perfect person to read out the final scenario for us. Miss Eva, are you ready for this one? Miss Eva, are you there? I think Miss Eva is having some internet connection problems. I read out this scenario for you,
Yeah, I can
coders.
read it.
Okay,
Yeah, I can read it. Can I?
thank you. Yes, sure, Miss Anu.
Okay, fine. Okay. The answers are 93925, I 83.11, I 83.12, and I 83.813. Option B 93971, I 83.11, I 83.12, and I 83.813. Option C 93970, I 83.11, I83.12, I83.813. And option D, 93985, I83.11, I83.12, and I83.813. Pre-procedure diagnosis: persistent right and left leg pains, extensive varicose vein disease. Post-procedure diagnosis: varicose vein disease with inflammation, venous insufficiency, leg pains due to varicose veins. Procedure: peripheral vascular duplex ultrasound evaluation of the venous anatomy of the lower extremities. Patient's right and left leg venous anatomy was examined in the standing position utilizing a B-mode duplex ultrasound machine with a 12 MHz probe. The focus was to determine the location and flow characteristics of both, both the deep and superficial venous systems. The evaluation included dynamically focused grayscale and color imaging supplemented by Doppler spectroanalysis. Valsalva, Valsalva maneuver as well as cuff and thigh compressions were performed to determine the patency and direction of blood flow. The exact paths of venous reflux in the major venous trunks, tributaries, and perforated veins. Ultrasonic mapping included images of major deep veins of the leg, saphenofemoral junction, the great saphenous vein above and below the knee, and the short saphenous vein system below the knee. Measurements and flow characteristics were obtained and listed on venous map in chart. Bilaterally, the great saphenous veins were absent, beginning at the saphenofemoral junction. Due to previous surgery, noted was venous reflux and enlargement of neovascular and tributary portions of the vein systems in the upper and lower legs. Abnormalities and associated perforator veins were documented on venous map in chart. The internal diameters of the leg varicosities varied to 5 and 3.8 mm in diameter. Bilaterally, no evidence of deep venous reflux or thrombosis noted within the femoral, pop- poplit- popliteal, gastrocinosis, or posterior tibial vessels. Photocopies were taken of the venous abnormalities and are included in the medical record. Findings: 1. Varicose vein disease with inflammation. 2. Venous insufficiency. And 3. Leg pains due to varicose veins. Coders, here the time starts now.
Coders, that's not time, but still, since we have crossed our scheduled time, I will just call that as time, and it's just around 2 minutes now, and I will read out the scenarios, the highlighted keywords. You can go ahead and continue doing the scenario. You can take a screenshot as well. So the keywords for this scenario, thank you, Miss Anu, for volunteering and reading out that scenario for us. The post-procedure diagnosis will be varicose vein with inflammation, venous insufficiency, and pain in legs due to varicose vein. The procedure performed is going to be peripheral vascular duplex ultrasound with a venous anatomy of lower extremities. The patient right and left venous anatomy was examined during the study. It was a B mode duplex ultrasound machine which was used. A Doppler spectroanalysis was performed. Great saphenous vein. The short saphenous vein system below the knee was also examined. The correct answer for this scenario is going to be option C. That's what most of you have answered. It's too good. It's so I'm so happy to see most of them have answered the correct one, and I can see the confidence which is gaining throughout these 4 weeks of group study sessions in solving the long scenarios. And these are the procedure inventories: peripheral vascular duplex ultrasound, evaluation of the venous anatomy of the lower extremities was performed, and the diagnosis we are having varicose vein disease with inflammation, venous insufficiency, and the pain in legs due to varicose veins. And these are our code options. I've done some churning before we solve the scenario. The 93925 is coding for duplex scan of arteries. 93970 is coding for duplex scan of veins bilateral, and 93971 is coding for duplex scan of veins unilateral, and 93985 is coding for duplex scan of veins and arteries with a preoperative vessel assessment prior to the creation of hemodialysis access. So if I had this thing chunt, my CPT book chunt, straight away I will look into the procedure inventory and I will select the codes. So here, the procedure which is performed is a peripheral duplex ultrasound of venous anatomy of lower extremities. So the key word is going to be lower extremities. Venous duplex scan was performed. So this is a bilateral procedure which is performed. And 93985, which is coding for a duplex scan of arterial inflow and venous outflow of for preoperative assessment, vessel assessment to creation of hemodialysis access. So it was not a preoperative assessment performed here in our scenario. That's why option D is wrong. Let's look at option A, 93925, which is coded for duplex scan of lower extremities, or duplex scan of lower extremity arteries or arterial bypass graft. So this one is coding for arteries or arterial bypass graft. For our scenario, it was a venous anatomy scan of lower extremities performed. That's why option A is wrong. Option B, which is coding for duplex scan of extremities, veins, including the responses to compression and other maneuvers, unilateral or limited. So as I said, coders, we have done a scanning of bilateral extremities here, venous anatomy of lower extremities, which is performed. So it is not going to be option B, which is coding for a venous scan of unilateral extremity. The correct answer for this one is option C, 93970, which will be a duplex scan of extremity veins, including the response to compression and other maneuvers, complete bilateral study. So that's how we arrived into option C and selected the code that best matched our inventory. So that wraps up our 4 weeks study session, coders. Congratulations. The study sessions, the live study sessions are over so far, and we have ENM also left. But the ENM group studies will not be a live session like what we had for the last 4 weeks. It will be on demand. So there will be around 4 sessions of ENM, and that will be available for you on your LMS. Yes, it will be on demand. So as the other pre-recorded study videos, you will be having a link, you will be having an access to the link. You will be having that by on or before next week, I guess. So you can go over that and click the particular link, and you can do it all by yourself in your own timing. And please let me know if there is a feedback after this session. Please let us know how no, it will be in your LMS. It won't be the link won't be sent by you the email. So as you can see, it will be available in the LMS. So please let us know how you are feeling. How did this 4 weeks of study session help you in solving the long scenarios? Thank you to the entire intern team. You were amazing. I could have done that without you. Thank you, Miss Eva. So coders, all the best for the journey ahead. I hope this session's helped. Okay, coders, thank you, thank you, thank you. So see you all. Good night.
Thank you, Mr. Sandeep, for those AMCI amazing and awesome explanations. Miss Eva, for being the orchestrator and conductor of the best interns on the planet. Yes, I said it. Miss Melissa, Anubama, Courtney, Carla, let's get it, let's code, Dolly, and Miss Vivian. And let's not forget our interns in the chat, led by Miss Biji. And you, the students, you all are simply the best, and we appreciate you. And we will see you next time for more great scenarios. You don't want to miss it. And thank you for participating in the AMCI Medical Coding course. Until next time.